Good morning. In this video, we will discuss about tyrosine metabolism. Metabolism is a process which includes both anabolism as well as catabolism. Anabolism means synthesis. So first we'll start with synthesis of tyrosine. Tyrosine is a non-essential amino acid, which means it can be synthesized in our body. It can be easily synthesized from phenylalanine by a single-step process. When you compare the structure of phenylalanine and tyrosine, there is only one difference between them. That is an hydroxyl group. Tyrosine will be having an extra hydroxyl group. So to phenylalanine, if you add an hydroxyl group, it can be easily converted to tyrosine. The enzyme which adds hydroxyl group to phenylalanine is nothing but phenylalanine hydroxylase. Okay, this is the enzyme which converts phenylalanine to tyrosine. Okay, so this enzyme, it utilizes molecular oxygen, tetrahydrobiopterin and NADPH as its coenzyme. Okay, so this is how, with the help of this enzyme and these coenzymes, tyrosine is synthesized. Now here I would like to mention about a small clinical significance. When this enzyme is deficient, it leads to a condition called as phenylketonuria. So normally this phenylketonuria, which is an autosomal recessive disorder, is classified into 5 different types. In that, type 1 is caused by the enzyme deficiency, the deficiency of phenylalanine hydroxylase. Okay, so this type 1 is also called as classical phenylketonuria. Whereas the other types are caused due to the deficiency of the coenzymes involved in this pathway, in this step. Okay, for example, maybe due to the deficiency of tetrahydrobiopterin synthase or tetrahydrobiopterin reductase. Okay, but whatever may be the cause, it results in two major effects. Okay, what are those two major effects? Means if phenylalanine hydroxylase enzyme is not there, phenylalanine cannot be converted to tyrosine. So what will happen means there will be increased accumulation of phenylalanine in our body. On the other hand, there will be decreased production of tyrosine. When phenylalanine accumulates in our body, it can be metabolized by an alternate pathway. Okay, and it can be converted to phenyl pyruvate, phenyl acetate and phenyl lactate. Okay, so all these three together we call it as phenyl ketones. These phenyl ketones are usually excreted from our body through urine. That is why this condition is called as phenylketonuria. When it gets excreted in the urine and other secretions, it gives you a characteristic mousy odor, okay, which can help in, which can give you a clue to this diagnosis. Next, coming to the decreased tyrosine production, we all know that tyrosine is needed for the synthesis of catecholamines and melanin. In this, catecholamine acts as various catecholamines like dopamine, norepinephrine, epinephrine, all these things are produced. So all these things, they act as neurotransmitters. So if these neurotransmitters are not produced properly, the patients will manifest with various neurological manifestations like mental retardation, delayed developmental milestones, seizures and also psychosis. Okay, next, the second important product produced from tyrosine is melanin. This melanin is needed for the normal pigmentation of skin and hair. So what will happen means in this condition, patients will usually present with hypopigmentation of skin and hair. Okay, so these are the major biochemical alterations you can see in phenylketonuria patients. If you want to prevent all these manifestations, what you can do is you can diagnose it at the early stage and you can start the appropriate treatment. Appropriate treatment is very simple, nothing but the problem is due to excess phenylalanine and decreased tyrosine. So treatment should be restriction of phenylalanine and instead supplementation of tyrosine in the diet. Okay, that will be the appropriate treatment. But that should be started immediately after birth. Okay, then only they can, all these manifestations can be prevented. Okay, so for that, diagnosis at the early stage is very important. Okay, so in the olden days, they were using ferric chloride test and Guthrie's test for screening phenylketonuria. So in this, what is ferric chloride test means? The phenyl ketones which are produced in excess in this condition, they will react with ferric chloride and they will give a typical color. Okay, so from that we can easily suspect the patient may be suffering from phenylketonuria. But what is the problem with this ferric chloride test means? It is not specific for phenyl ketones. Even other phenolic compounds and salicylic acid can also give positive response for this ferric chloride test. Okay, next, coming to Guthrie's test, it is actually a bacteriological culture test which is done with the help of Bacillus subtilis bacteria. So this bacteria, it normally requires phenylalanine for its normal growth. So when it is grown in a blood of normal person, what will happen is normal person's blood will have very less phenylalanine quantity. It will be usually less than 1 milligram per deciliter. Okay, so at such low levels, this bacteria cannot grow. But whereas in the patients with phenylketonuria, the bacteria can grow nicely, and thus it can be also be used as a screening test for PKU. Okay, but all these things, the tests were done in the olden days. But now, after the widespread usage of tandem mass spectrometry, we can directly measure the blood phenylalanine levels and other metabolites which may be elevated in this condition. Okay, so the normal serum phenylalanine level is usually less than 1 milligram per deciliter, but in this condition it can grow up to more than 10 milligram per deciliter. Okay, so once you have confirmed the excess pressure of phenylalanine, then to confirm the enzyme deficiency, you can either go for enzyme level assessment, or you can directly go for the DNA study to analyze the mutation. Okay, so this is how diagnosis is done, and once you have diagnosis at the newborn period itself, you can start the appropriate diet therapy so that all the complications of PKU can be prevented at the early stage itself. Okay, so that's it about the synthesis and the disorder related to it, which is nothing but phenylketonuria. Next, we will move on to the catabolism part. So tyrosine, based on catabolism, it is classified as both glucogenic as well as ketogenic in nature. So that means it can be converted to both glucose use synthesis, and also it can be utilized for ketone body synthesis. So during catabolism, tyrosine will be broken down into two fragments. One is fumarate and the other one is acetoacetate. In this fumarate, which is actually one of the intermediate of TCA cycle, through TCA cycle, it will be converted to oxaloacetate. That oxaloacetate will enter the glycolytic pathway as phosphoenol pyruvate, and from then it can be diverted for gluconeogenesis. Okay, so that is how it will be used for glucose synthesis. On the other hand, acetoacetate produced, it can be used for ketone body synthesis. Okay, so that is why we call tyrosine as both glucogenic as well as ketogenic in nature. This is just an overview about the catabolism. Now we will see in detail how all these things happens. For most of the amino acid metabolism, the first step in their catabolism is the removal of amino group and converting it into its corresponding keto acid. This is usually done by an enzyme called as transaminase, which uses pyridoxal phosphate as its coenzyme. So for tyrosine also, we have a specific transaminase called as tyrosine transaminase. Okay, so this tyrosine, when you see the structure of tyrosine, it is nothing but a phenylalanine with an extra hydroxyl group. So it can also be called as para-hydroxyphenylalanine. Okay, now from this alanine, if you remove an amino group, it will be converted to pyruvate. So tyrosine, by the action of tyrosine transaminase, it will be converted to para-hydroxyphenyl pyruvate. Okay, from the phenylalanine part, the amino group is removed and it is converted to pyruvate. So it forms para-hydroxyphenyl pyruvate. Now this para-hydroxyphenyl pyruvate, it undergoes two oxidation steps. The first step is mediated by the enzyme hydroxylase. Okay, so this hydroxylase, as the name says, it will add one more hydroxyl group to the structure and converts it into homogentisic acid. The second oxidation step will be catalyzed by the enzyme oxidase, and this oxidase, as the name says, it will oxidize the homogentisic acid. It will break the ring structure and converts it into a linear mallyl acetoacetate. Okay, so this is the next phase. Okay, so first phase is transamination and converting it into a keto acid. Then two oxidation step, which will break the aromatic ring and converts it into a linear structure called as mallyl acetoacetate. Okay, so now we have got acetoacetate. Okay, so only thing is this mallyl has to be converted to fumarate. So how it can be converted means by an enzyme called as isomerase, mallyl acetoacetate can be initially converted to fumaryl acetoacetate. In the subsequent step, an hydrolase enzyme, it can break this fumaryl acetoacetate and converts it into fumarate and acetoacetate. Okay, in this, the fumarate, which is glucogenic in nature, it will be diverted for gluconeogenesis, whereas acetoacetate will be diverted for ketogenesis. That is why tyrosine is called as both glucogenic as well as ketogenic in nature. Okay, so that's it about tyrosine catabolism. Now we will discuss about the disorders related to this tyrosine catabolism. Whenever any of these enzymes are congenitally deficient, what will happen? Tyrosine cannot be metabolized. So they will be accumulating in the body. Okay, so and ultimately it can lead to a condition called as tyrosinemia. This tyrosinemia, it can be further classified into three different types depending on which enzyme is defective. Okay, in type 1, the last enzyme of the pathway, which is nothing but fumarate acetoacetate hydrolase. Okay, so that enzyme will be defective. When that enzyme is defective, what will happen? The fumarate acetoacetate will accumulate. Okay, so that fumarate acetoacetate in turn, they will deposit in the kidney and liver, and it can cause damage to these two tissues. That is why type 1 tyrosinemia is also called as hepatorenal tyrosinemia. Next, coming to type 2, here the first enzyme is defective. Okay, in type 1, the last enzyme, whereas in type 2, it is the first enzyme, which is nothing but tyrosine transaminase. Okay, so when that enzyme is deficient, tyrosine will be accumulating, and it usually affects the skin and eyes. Okay, so that is why it is also called as oculocutaneous tyrosinemia, or otherwise called as Richner-Hanhart syndrome. Next, the third type 3 is due to the second enzyme. Okay, so what is the second enzyme? Para-hydroxyphenyl pyruvate hydroxylase. Okay, so when that is deficient, we call it as type 3 or neonatal tyrosinemia. Okay, so these are the various types of tyrosinemia. Okay, so apart from these enzymes, there is also one more enzyme called as homogentisic acid oxidase. When that enzyme is deficient, it leads to a condition called as Alcaptonuria. So what will happen means, actually this Alcaptonuria, which is an autosomal recessive disorder, is a part of Garrett's tetrad. Okay, tetrad means it is a complex which includes 4 different congenital disorders. Okay, so what are those 4 different congenital disorders means? Phenylketonuria, Alcaptonuria, sorry, it's not phenylketonuria, it is Alcaptonuria, albinism, essential pentasuria, and cystinuria. Okay, so these 4 disorders together we call it as Garrett's tetrad. Okay, so our Alcaptonuria is one part of that Garrett's tetrad. Okay, so this is an autosomal recessive disorder where this homogentisate oxidase will be deficient. So when this enzyme is deficient, homogentisic acid will be accumulating in our body. So that homogentisic acid, it will be in turn will be oxidized by polyphenol oxidase, and it will be converted to benzoquinone acetate. This benzoquinone acetate polymerize with each other and results in the formation of a compound called as alcaptone. Okay, and that alcaptone will be excreted in urine. That is why this condition is called as alcaptonuria. Okay, so this alcaptone actually typically imparts a black color to the urine. Okay, so here when a patient, when it passes the urine, normal freshly voided urine will be normal color, but when you allow it to stand, the alcaptone bodies will get oxidized and they will become dark black in color. Okay, so it gives you black color urine on standing. That is one of the clue for diagnosing alcaptonuria. Okay, for phenylketonuria, the clue is mousy odor in urine, whereas in alcaptonuria it is a black colored urine. Okay, so apart from getting excreted in urine, this alcaptonuria will not cause any much damage to our body, but sometimes in the older age, what will happen means this excess alcaptone bodies, they can get deposited in the cartilages, bones and cartilages, mainly the vertebral disc, pin of the ear and all, they can get deposited, and it can lead to a condition called as ochronosis. Okay, so that is the only complication you can see in this patient. Okay, so now how to diagnose this case means, same, we have few screening tests like ferrichlorate test. Okay, so I said in the phenylketonuria also we use the same ferrichlorate test. I said there only I said it is not a specific test. Okay, it can be answered both by phenylketones and also by the homogentisic acid can also answer it. Okay, but here in alcaptonuria, along with ferrichlorate test, even Benedict's test will also be positive. Okay, if both ferrichlorate and Benedict's test is positive, then you can suspect alcaptonuria. If only ferrichlorate test is positive, then you can think about phenylketonuria. Okay, so all these things are just screening tests which were followed in olden days, but now currently after the widespread use of tandem mass spectrometry, we can directly measure the blood or urine homogentisic acid levels. Okay, so if it is elevated, then we can easily make out the diagnosis as alcaptonuria. Okay, so that's it about the tyrosine metabolism and its related disorders. So coming to the synthesis, to summarize, so synthesis, it is synthesized from phenylalanine by the enzyme phenylalanine hydroxylase. So when that enzyme is defective, it leads to a condition called as phenylketonuria. Okay, next coming to the catabolism, tyrosine is catabolized by series of enzymes and it is broken down to produce fumarate and acetoacetate, which will be used for both glucose as well as ketone body synthesis. Okay, so the major enzymes involved in the pathway are, first to start with, tyrosine transaminase. Okay, so deficiency of that leads to type 2 tyrosinemia. Okay, second enzyme is para-hydroxyphenyl pyruvate. When that enzyme is deficient, it leads to neonatal tyrosinemia. Next is homogentisic acid oxidase. When that is deficient, it leads to Alcaptonuria. And the last enzyme is fumaryl acetoacetate hydrolase. When that is deficient, it leads to type 1 Thyrosinmia. Okay, so that's it about tyrosine metabolism. Thank you.